My name is Consolata Kavanesa. Yes, position Associate Professor, Makerere.
The laws on violence and harassment in the workplace are in place. Yeah? The Employment Act, Employment Sexual Harassment Regulations of 2012. We have Uganda Public Service Standing Orders, Occupational Safety and Health Guidelines for Office Work Environment 2021. And some of these actually are put out by the Ministry of Gender. Yes? So they are for everyone to follow. There is the Gender-Based Violence Act. It is there. All those are for us to use and actually go ahead and implement them. But they are there, but violence and harassment is still rampant. It is actually saddening when you hear what people are saying, what is happening in the workplace. And it is very important for us to really come out and say how it is going to be handled. Of course, number one was sexual harassment, and I have voices that I will give you in here. Psychological and emotional violence. Psychological and emotional violence, these ones you don't see them. You don't. But the way you treat somebody, the way you talk to them, it can be very damaging to their self-esteem. Sexual harassment is the most form of bullying, and it is a big issue. Now, who is harassed? Who is harassed? You had Doctor already told us. It is the young people. It is people who are considered to be weak. People who are considered to be below the abuser. And here, in the health sector, it was very well narrated. Senior males bully junior females. Politicians, believe it or not, politicians go out of their way to go to hospitals and bully officers there. Security, those security guards, ladies, are harassed. Superiors harass supervisees. Then you have the in charge, they harass juniors. And seniors harass juniors, and female harass males. It is not common, but it is there. It is not common, but one person at least mentioned it. Males harass females, patients harass caretakers. Patients harass caretakers. Doctors harass patients. So if you're a patient, are you in good hands? The doctor is going to harass you. Patients harass nurses and female doctors, and doctors harass nurses and midwives. And one person said actually that for nurses and midwives, you cannot say no. You cannot do what? You cannot say no. Because the culture, if the doctor says, I would like to sleep with you, you do not say no. Because the culture is in health, you have to say, yes sir, yes doctor, yes whatever. So it is really saddening what nurses and junior doctors, they have to go through. Because If they cannot say no, what does that mean? That they are harassed now and then. In education sector, lecturers harass students, students harass lecturers. It is not common, but it is there. Somebody said this. By the way they dress, by the way they approach the lecturers, and they said this is in the name of grades, marks. I want a better mark. So I have to go and sit in front of the lecturer and maybe spread my legs or wear something very short or go to his office and try to entice him. Yeah?
We came up with these as trade unions. What can you do? Unions should champion activities to achieve sexual harassment, to drive sexual harassment out of the workplace. So they are saying it is your responsibility to ensure that sexual harassment is out of the workplace. Somebody said you have to lobby, 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 lobby. In other words, don't get tired, because issues of gender, you can never get tired. And issues of gender are not easy to achieve. Why? Because you are looking at mindset change. And mindset change takes time. So don't get tired. Unions can approach institutions like Ministry of Gender, Labor and Social Development. They can actually work with Parliament, with education institutions, religious institutions, cultural institutions, to get their views and the matters on violence and harassment. And then, of course, networking. Networking, that you need to network with other civil society. You can work with civil society organizations, with human rights organizations, with the Human Rights Commission. You can work with comedians. You know, some of these things, you can achieve them in different ways. And they are saying also music, musicians, dramatists, to pass the message on, to educate people about C90, so that they can start working. And unions should petition government to pass C90. I already said that actually the Occupation Safety and Health Act is based on these ones, and they are there. And we have already a Gender-Based Violence Act. So why can't we sign? Okay? And then, of course, we need to organize joint meetings between management, the union members, and the employees, so that you are all talking the same language, so that each one of them, you know what is required of you, you know how far to go and how far not to go. I thank you.